Hi everyone, let's quickly revise important scores in pediatrics under 5 minutes which are very much important for NEET PG and FMGE exam. So starting with APGAR score. APGAR score is a quick assessment of newborn adaptation after birth. It includes 5 parameters and the mnemonic is the name itself. A stands for appearance. If the baby is blue, the score is 0. If the baby is pink with blue extremities, the score will be 1. If the baby is completely pink, then the score is 2. P stands for pulse. If pulse is absent, the score is 0. If less than 100, the score is 1. And if it is more than 100, the score is 2. G stands for grimace. If on stimulus there is no response, the score will be 0. If minimal response, the score will be 1. And if the baby coughs or there is sneezing or crying after stimulus, then the score will be 2. A stands for activity. If the baby is flaccid or limbs are in extension, the score will be 0. If there is partial flexion, then the score will be 1. If complete flexion, then the score will be 2. R stands for respiratory effort. If the respiratory effort is absent, the score will be 0. If there is weak cry or labored breathing, then the score will be 1. Or if there is a strong cry, that means the baby is normal and the score will be 2. So the total score is 10. And the interpretation is, if the score comes out to be 0 to 3, there is severe depression and resuscitation is needed. If the score is 4 to 6, then there is moderate depression and it needs close monitoring and support. If the score is 7 to 10, then the baby is normal and reassurance is needed. APGAR score is calculated at 1 minute and 5 minutes. If the score is low, then it is repeated at 10th minute. Coming to our next score, that is Downey's score. Downey's score is used to assess respiratory distress in newborn, particularly in term neonates. It includes 5 parameters: respiration, cyanosis, air entry, retraction and grunting. If the respiration is 40 to 60 per minute, the score is 0. If 60 to 80 per minute, the score is 1. If more than 80 or apnea is there, then the score will be 2. Then coming to our next parameter, cyanosis. If cyanosis is absent, the score will be 0. If cyanosis is present at room air, then the score will be 1. And if the cyanosis persists despite of more than 40% oxygenation, then the score will be 2. Then our next parameter is air entry. If air entry is good, the score is 0. If the air entry is decreased, the score will be 1. And if the air entry is barely audible, the score will be 2. Coming to retraction, if no retraction, then the score will be 0. If mild retraction, the score will be 1. And if there is marked retraction, then the score will be 2. Then next is grunting. If no grunting, the score is 0. If the grunting is audible with the stethoscope, then the score will be 1. And if the grunting is audible with naked ear, then the score will be 2. The mnemonic to remember the parameters, the 5 parameters is RG CAR. As we all know, RG CAR Medical College. R stands for respiration, G stands for grunting, C for cyanosis, A for air entry and R for retraction. This way we can remember the parameters of Downey's score. The interpretation is, if the score is 0, then there is no respiratory distress. If the score is 1 to 4, there is mild respiratory distress. If the score is 5 to 7, there is moderate respiratory distress. And if the score is more than 7, then there is severe respiratory distress. Coming to our next score, that is Silverman-Anderson score. This is also used to assess the respiratory distress in newborn but in preterm babies. The parameters are upper chest movement, lower chest movement, xiphoid retraction, nasal flaring and expiratory grunting. The mnemonic is chest, chest, xiphoid, nose, grunting. Chest, chest, xiphoid, nose and grunting. The first case is upper chest movement. If there is synchronized upper chest movement with abdomen, then the score will be 0 and this is mild condition. And if there is a chest lag on inspiration, the score will be 1. If there is seesaw movement, then the score will be 2. Coming to lower chest movement, if there is no lower chest movement, the score will be 0. If the lower chest movement is just visible, the score will be 1. And if there is marked lower chest movement, the score will be 2. Coming to xiphoid retraction, if no retraction, then the score is 0. If the xiphoid retraction is just visible, the score is 1. If the xiphoid retraction is markedly visible, the score will be 2. Then next is nasal flaring. If no nasal flaring, then the score is 0. If minimal nasal flaring, the score is 1. If marked nasal flaring, then the score will be 2. Next is expiratory grunting. If no grunting is there, the score is 0. If the grunting is audible with the stethoscope, then the score is 1. If the grunting is audible without stethoscope, that is by naked ear, then the score will be 2. If the total score is 0, then there is no respiratory distress. If the total score is 1 to 3, then there is mild respiratory distress. If the total score is 4 to 6, there is moderate respiratory distress, and if the score is more than 7, there is severe respiratory distress or impending respiratory failure. In this condition, we should consider mechanical ventilation. So that's all about important scores in pediatrics.